Welcome to the start of our physiology video series. We're going to begin this series with body fluids, and these form kind of the basis of which we'll learn more about the basic physiology of the human body before moving on to the different systems, as we will do in other areas as well. So let's begin with our first vignette. A 69-year-old gentleman presents to the emergency department with a 3-day history of shortness of breath and cough. He has a past medical history of diabetes, hypertension, and myocardial infarction. Further history reveals worsening of symptoms on lying flat and that he wakes up at night to catch his breath. Physical examination reveals an elderly man short of breath with distended neck veins. Examination of the chest reveals a displaced apex beat and bibasal inspiratory crackles with an associated wheeze. This patient's symptoms may be attributed to 1. Increased hydrostatic pressure, 2. Increased oncotic pressure, 3. Decreased hydrostatic pressure, 4. Decreased oncotic pressure. So before we discuss the answer to the previous vignette, we're going to begin by talking about the distribution of body fluid. So it's important to consider where and how much fluid is within the human body, as this is important in terms of considering cellular function. In terms of the human body, we're about 60 to 70% composed of water, which is quite a significant amount. The important thing to consider is where is this actual water found? In terms of the distribution of the body water in us, most of it is found within cells or intracellularly. As this diagram reveals, about 2/3 of the water in our bodies is found within the intracellular space. The remaining third is found in the extracellular space, of which it may be in two different compartments. In the extracellular space, it may be within the blood circulation, known as the plasma volume, or it may be between cells outside of the circulatory system in what's called interstitial fluid. When you look at the extracellular fluid as a group, comprising 1/3 of our total body water, most of the fluid in the extracellular space is found in the interstitium, with a small amount found in the actual plasma volume. So now that we understand how our total body fluid is distributed, we need to consider the barriers to movement of this fluid. And generally what I'd like you to remember are two distinct barriers. The first barrier is a semi-permeable membrane between cells pretty much and the space around them. So in a cell, it has a plasma membrane composed of a phospholipid bilayer. And this is a plasma membrane that separates the intracellular space from the extracellular space where that fluid is found. The second barrier that I'd like you to consider is the barrier that divides the extracellular space, that between the actual plasma volume and the interstitium. And this is an endothelial lined membrane that particularly is important when one considers a part of the circulatory system known as the capillary bed. And it's across these capillaries, these small blood vessels that are found between arteries and veins, that a lot of the migration of water occurs between the extracellular fluid compartments, that between the blood vessels themselves and their surrounding interstitium. So in summary, there's two real membranes that are important when considering the distribution of body fluids: the cell membrane and the capillary membrane. So now that we've discussed body fluid and its distribution across membranes and how it's divided into the two different compartments of intracellular and extracellular fluid, we need to consider the concept of osmosis, and particular two definitions: osmolarity, which is the concentration of particles in a fixed volume of liquid or solution, and osmolality, which again is the concentration of particles in a fixed weight or amount of solvent or solution, so in kilograms rather than liters. So the movement of water is very much dictated by the concentration of solute in a solution, or the concentration of particles in a solution. what you'll find is that water will move across permeable membranes from an area of low osmolarity, an area with little amount of particles in its area, to an area of high osmolarity, so an area that has a greater number of particles per volume or per liter of solution. So to summarize, water will move across a gradient towards an area of high osmolarity. And you can think about it doing so to kind of equalize the osmol gap between the two solutions across a membrane. So water will diffuse across these permeable membranes or semi-permeable membranes, and it can do it in a number of different ways, but typically it does it in between gaps in between the actual cells lining these membranes. So for example, when we talk about capillaries in the upcoming section, you'll notice that there are gaps between the endothelial cells lining the inside of capillary beds. Those are the blood vessels that are found between arteries and veins. And they pass through these little windows in the blood vessel, known as fenestrations, and can move across it quite freely. And it does so for a number of reasons which we'll discuss later, but consider that if you had in your blood vessel a low amount of particles and you had a higher amount of particles outside of your blood vessel, water would be inclined to, by osmosis really, move across that gradient towards the area which is a higher solute concentration. And so that is the definition really of osmosis. So now that we've considered the concept of osmosis, we can build our understanding of the basic physiology of the movement of fluid towards answering the original vignette question. The next section we need to consider is that of oncotic pressure, which is really an expression or a derivation of the concept of osmosis, but you need to think about it in a slightly different way. Oncotic pressure is also referred to as colloid osmotic pressure, and it refers to the pressure exerted by proteins within the vascular system, particularly within the capillary bed, which we'll consider later. And the pressure that it refers to is the pressure that's exerted by these proteins, which will remain within the vascular system and therefore cannot freely diffuse, unlike water, across these semi-permeable fenestrated membranes. And it is a pressure that tends to, by its nature, draw water and draw fluid into its own compartment by exerting an osmotic pressure. And therefore, when we consider the capillary bed, we can understand really that there are two essential conflicting or contrasting pressures that are exerted within and outside the actual vascular bed. So let's look at an example of this, and let's look at this image of a capillary bed found between, at its proximal end, an arteriole, and at its distal end, a venule. And so what you'll see within this actual capillary bed are two competing forces. That of the hydrostatic pressure, that is the pressure exerted by the presence of fluid within the actual capillary. And so the more fluid at the start under greater pressure from the heart is trying to push itself or its own fluid out into the interstitial space between those fenestrae found between the capillary bed. And so the hydrostatic pressure tends to force water and some solutes out into the interstitium. You may note that as we progress along the capillary from its proximal arteriole to its distal venule end, that this hydrostatic pressure will decrease naturally as a result really of two phenomena. One, in that it's further away from the heart and the pressure is reducing, and secondly, due to the loss of this fluid along the proximal part of the capillary itself, and therefore naturally the pressure will decline the further you move along the capillary bed. So that's hydrostatic pressure. You should also note that there's a competing hydrostatic pressure from the fluid outside the capillary in the interstitium that's actually forcing fluid to move back into the capillary bed. So hydrostatic pressure can work in both directions, but the direction is away from where the fluid itself is. We return to oncotic pressure, and if we look at the proteins in the actual capillary itself, we note that they become more concentrated as you move towards the distal venule end as a result of the loss of all that fluid initially by means of the hydrostatic pressure. And the more concentrated these proteins become, in that compartment, the greater their osmotic or oncotic pressure and their tendency to draw in fluid or water from the surrounding interstitium. So really, when you consider the capillary bed, you need to consider the four forces: the hydrostatic pressure within the vessel and the hydrostatic pressure of the fluid surrounding it, and the oncotic pressure of the proteins within the actual capillary bed, which increases as these proteins become more concentrated as you move towards the venule end or the venous end, and the oncotic pressure of proteins found in the interstitium. And together, when you actually map out or calculate all these different pressures, you can generate an idea or create an idea about how the fluid will move along a gradient. Will it move outside into the interstitium or inside into the capillary bed? And there's actually a mathematical equation which pretty much explains this phenomenon, known as the Starling equation. And we'll discuss this now in the next section. So the Starling equation calculates the net movement of fluid across a semi-permeable membrane such as the capillary bed. And it's calculated using the following equation. You take away the hydrostatic pressure of the interstitium from the hydrostatic pressure of the plasma space, and subtracted from this is the oncotic pressure of the capillary bed, taking away from that the interstitial oncotic pressure. Also involved is what's called a reflection coefficient, and this is referred to as a correction factor. So it is pretty much a dependent factor based on the area in which the capillary bed is found. So in certain tissues, certain capillaries will be subject to rather or more susceptible to pressures than other capillary beds. For example, in your kidneys, the glomerular capillaries generally do not let proteins cross their membranes, whereas in other areas of the body, such as the liver, proteins typically cross the membranes with much more ease. So really, you can think of the reflection coefficient as a measure of function of how easily will proteins, particularly large proteins within your blood vessels, cross the actual capillary bed. So when you look at these actual different components and components as part of this equation, you can come together to actually see what is the net force that's driving fluid across a capillary membrane. So now that we've covered those key concepts of body fluid distribution, osmosis, hydrostatic pressure and oncotic pressure, we can return to our opening vignette, where the question was a patient with those signs and symptoms and physical examination findings. What was the actual vignette telling us, and what were the reasons, physiologically speaking, for the patient's symptoms? Well, the patient had congestive heart failure, and that was evident from a number of factors. The patient was short of breath, particularly on lying flat, and had risk factors for congestive heart failure. In terms of their physical examination findings, the displaced apex beat, the finding of fluid in their lungs, particularly crackles and a wheeze, and the raised neck veins all point as well to congestive heart failure as the most likely diagnosis they were trying to lead you to. So now that we know the patient has congestive heart failure, we need to consider, physiologically speaking, what was actually the reason for the fluid accumulating in their lungs. And the answer to that is increased hydrostatic pressure. And what you need to understand is that by the failure of the heart to pump blood forward leads to an increase in blood pressure, or arterial blood pressure and venous blood pressure in the circulatory system, particularly in the pulmonary bed. And this increased hydrostatic pressure allows fluid to cross that capillary membrane into the lung compartment. And so what the real understanding you need to get from this is that there's increased hydrostatic pressure within the pulmonary vasculature. So the correct answer was A, increased hydrostatic pressure. Further examples of how this concept might be tested in terms of a clinical vignette would be to consider the concept of oncotic pressure, or colloid osmotic pressure, which is a function of the protein concentration within the capillary bed. So when we think back to what we discussed earlier, we know that really proteins exert this osmotic force which causes fluid to be drawn into the capillary space. In patients with low protein, that might be patients with end-stage renal disease or patients who have hepatic or liver dysfunction where their ability to synthesize or make proteins is impaired. These people, or patients rather, will be low on protein in terms of their blood concentration. And this decrease in protein in their blood will lead to a reduced oncotic pressure. So the vignette or the clinical presentation you may be given may be someone with features of liver disease. They may be jaundiced, have an enlarged liver, and they may have fluid in the abdomen in the peritoneal space known as ascites. So when you examine them, they may have a distended abdomen. They may have a fluid thrill. So when you tap on their abdomen, you may feel a fluid wave in their abdomen. And they may also have what's called shifting dullness. So when you percuss their abdomen out towards each side or the flanks, you may find that it progressively becomes duller. And then when you move the patient, the area actually becomes resonant due to the movement of free fluid within this peritoneal space. And this movement of fluid into the peritoneal space is due to a lack of albumin and other proteins, which reduces the plasma oncotic pressure. And that's the mechanism involved in the accumulation of fluid in someone, for example, with liver disease. So that sums up our first introduction to physiology, and in particular the importance of body fluids. We'll go into this area in further detail in the next section, but I just want you to remember the important concepts we've covered, namely the distribution of fluids within the intracellular and extracellular space, the osmotic pressure and the importance of understanding osmolarity and osmolality, and the importance of understanding hydrostatic and oncotic pressure and their clinical applications.